My story goes back to, I guess it was July 10th of 2023. Okay, this particular day, I had a doctor's appointment with my general practitioner, my regular doctor. It was just like a routine physical, and I had no idea what would happen that day. And at the time, this was before I retired last year in April of 2024. At the time, I was still working. I was a project manager with the Social Security Administration, IT, and I was still working. So after this appointment at my doctor's at 10 a.m., I was just going to go to work and do my regular job as I had been for over 30 years working there. And while I was having this physical, the doctor decided to do an EKG, and he did the EKG, looked at it, and then he came in the room, and he's like kind of like almost, he wasn't really panicking, but he was adamant. He says to me, "I think you're having a heart attack." And I said, "No, I'm not having a heart attack." He says, "I called an ambulance and they're going to take you to the hospital." I said, "I'm not going to ride in any ambulance. I'm not going to the hospital. I feel fine." No, I said, "No, I'm okay. There's nothing wrong with me. I'm not having a heart attack. I don't feel anything." And so he said, "Well, if you're not going to go in the ambulance to the hospital, will you promise me that you go to the emergency room right after you leave here and have them examine you?" So I said, "Okay, all right, fine." So I drove from Cadensville out on Route 40, where the Ascension St. Agnes doctor's office is, to here. And he had called in advance to here to have me to be examined. And what ended up happening was Dr. Plack, who's a cardiologist here, he did a catheterization on me. And he said, "You may have been having a minor heart attack, and I'm going to check this catheterization to see if you could just get a stent or something that would solve your issue." And I said, "Well, I didn't." He said, I think he said I was like 75 or 85% blocked in my arteries. I said, "Okay." And so he did this catheterization. Then he said, "Okay, you need to have an open heart bypass surgery immediately." And I'm like, "What?" I mean, I was kind of shocked about it. And I said, what do I need to do? And immediately they transferred me from St. Agnes out to St. Joseph's Heart Clinic out in Towson. Like, they just took me in an ambulance that afternoon, and I had to stay there for a week. And this whole thing came about. It was like a shock to me. So after that, I went home, and I had like home, how they generally do is they have home rehab. They send rehab people to your house, and and for a while there, I think I had to take like 12 medications every day. And then I came, and they said, you should go to rehab. You should go to the cardiac rehab program. They have one at St. Agnes, or they have one at St. Joseph. I said, "Well, St. Agnes is closer for me, so I'd rather go to St. Agnes." And by that time, I started, before I had the surgery, I think I weighed like 295 pounds. And I was noticing shortness of breath and stuff in the weeks leading up to that whole thing. I did have funny feelings in my arms and stuff, but I didn't think about it too much because I didn't really feel sick or pain or anything. But I decided to come to this therapy, and by then I had lost like 20 pounds from like 295, and then I started coming to this therapy here and exercising and taking the advice, learning how to eat better. So I take the advice to heart, and actually from the time I started here, I weighed like 270. Like, I weighed myself this morning, I was down to 258. I'll tell you the truth, I really loved coming to this rehab therapy here at St. Agnes. I had a good time. I thought it was fun. When I first started coming, they made me do a walking test out in the hallway and walk real fast, and I was I was having trouble doing it. But then, as I got used to exercising, and tips about what kind of exercises to do, and every day I would come here, I would get weighed and have my blood pressure checked. I thought it was a great time. It was actually like having personal trainers that would like follow you around for like an hour, 3 days a week, and doing things that are, giving you an ideas about like what is good exercise, what exercise you need. Interestingly, even before that heart surgery, I had been a member of Planet Fitness for like 10 years. So even before that, I was exercising 2 or 3 days a week. But I think since I've been into this therapy, I think I've been exercising between 4 to 7 days a week. I exercise almost every day. Well, I mean, even though I was exercising before I came here, I got a better idea of like what kind of exercises makes for a heart healthy existence. But since I retired, I've actually volunteered, and I am several days a week monitoring the gym at the Catonsville Senior Center. So I'm there at the Senior Center at least 1, 2, maybe 3 times a week for like 3 or 4 hours. So I have plenty of time to exercise and work out while I'm there. And like I said, I think my diet has been better, and my weight, and I'm more conscious of what my weight is, and definitely eat a lot less salt and that sort of thing. But I thought it was much more comprehensive of a program than I expected. I mean, like the monitoring, we put those heart monitors on every day, and they would, keeping track of the blood pressure before you start, and the training for dietary needs and all that. It was much more than I expected. I thought I would just come here and they would have me do some exercises, but there was much more, let's say, scientific basis to it. And I think I really learned a lot coming to this. And the staff is great. There's like a lot of good people here, and I really enjoyed what they taught me and how they interacted with the other people that were the patients here. And I'd recommend it to anybody. I really would recommend it. I mean, if I could come back and do it for like a couple more weeks, I'd do it again. But and I feel like it was very beneficial to me and my health. And I think it was, like I said, I'd recommend it to anybody to come here if they had like a heart issue or heart surgery or heart attack. Come here and be monitored and taught about like what kind of exercise you need to do, and what kind of diet you should have, and try to control weight and whatever else would make you more healthy.
So my story really starts in 2007. I was about 215 pounds, and my wife, who I adored, we'd been married 29 years, she died of cancer. And I fell apart emotionally and psychologically. The analogy I used was it was like being run over by a bus emotionally. One day, you're planning your empty nest, and the next day you're in the ICU wondering what happened. She was just gone, and there was nothing I could do about it. And I really threw away all of my self-control and all of my desire to do anything healthy. And in the next 3 years, I gained over 100 pounds. I went from 215 to 319. Drank heavily, damaged my liver, ended up with diabetes, damaged my kidneys, damaged my eyes, damaged my feet. Didn't care, just didn't care for like 15 years. And in November 21st of 2022, I had this tremendous pain in my chest. And I couldn't believe that it was a heart attack because I took atorvastatin. I knew I had familial hypercholesterolemia, which is inherited high cholesterol. I just couldn't believe that it was a heart attack. I mean, I'm a physician assistant. I couldn't believe it. And I called my brother, who's a doctor, and I said, "Can you tell the difference between heartburn and a heart attack?" He says, "You know you can't. You're a PA." But it was 2 days before Thanksgiving, and I didn't want to mess up the holiday. The kids were coming over, and I went to bed. I was taking antacids. I kept taking different kinds of antacids because the pain would come and go, but it was worse than I had ever felt with heartburn. And it was right in the center of my chest. I knew it was a heart attack, but I was in complete denial. I went to bed. The pain woke me up about 5 o'clock. I took more antacids. I'm a hobbyist with Lego. I do Lego for a hobby, and I was trying to Lego, and I thought, you know what, I need to go to the ER. So they took me straight to the cath lab. I was catheterized that night. Got 5 stents on my RCA, my right coronary artery. My big event was that night. I was talking with the nurse. It was late. I was reflecting. And for the 15 years since my wife had died, and since I'd become morbidly obese, I just didn't care if I lived. She'd always lived right. She got cancer out of the blue. You know, she kept her weight down. She nursed her kids. She never smoked. It was so unfair. And I just had this epiphany. I thought, I don't really want to die. I really do care. And for years I've been saying, I don't care, but I really did care. I was really afraid that night, you know, after my catheterization, that I don't want to die. And that was the turning point for me. So when I got out of the hospital, 4 or 5 days later, they said, well, you know, after a few months, this was November 23, they said, after a few months, when your body's had a chance to adjust, we're going to send you to cardiac rehab. So the end of February, I started cardiac rehab here at Ascension. And I have to say, it was amazing. Everybody was patient. I mean, you know, I'm kind of, you know, a disruptive individual. I make jokes, I talk all the time. They were fantastic, just lovely, every one of them. And there was a, you know, fitness specialist, there was a registered nurse, you know, we wore the cardiac monitors. I talked to Sarah, the dietitian. They taught us about cardio, they taught us about weightlifting. For me, when I left here, and I hate working out, I've never been a workout guy, never. But I cannot miss. I have to go work out 3 times a week. I was wondering what kind of gym should I join? What should I do when I left here? It's like, what do I do? They said, well, you know, the fitness centers in Baltimore County have, you know, I mean, the senior centers have fitness rooms. So I went to the senior center in Catonsville. It's a mile from my house. Took the tour while I was still in cardiac rehab, and I worked out here on Thursday. The following Monday, I was in the senior center working out. And I still weighed in the 280s. But Sarah had really given me a vision of how to eat healthy, and I really cut way down on the calories. I eat a lot of vegetables. I limit the number of calories I eat in a day. I do Weight Watchers, but I never joined Weight Watchers. But that's basically what it is. Just watch calories. You don't lose weight by working out. I might burn 1,500 calories a week working out. You lose weight by eating less. I mean, I know that as a physician assistant. I knew that the entire time I was a diabetic and I was destroying my eyes and my kidneys and my feet. But everything is coming back. The eye doctor that I went to for my diabetic retinopathy, I had serial visits, and he saw me, and then 3 months later he saw me again. He said, your eyes are better. He said, that never happens. He said, have you lowered your A1C? Have you lost weight? And I'm like, oh yeah, I've lost like 20 pounds. He's like, well, keep doing that. And my kidneys have not healed themselves. My liver has. My liver, I had fatty liver, stage 1. It's completely gone now. And my feet are slowly getting better, but it takes forever for nerves to heal themselves. But I guess I would say you have to, the thing for me, and this is what I often get asked, what was your motivation? My motivation was in that hospital that night, right after my stents were placed. And I realized I really did not want to throw my life away. I didn't want to die. And since I wanted to live, I wanted to live healthier. Because I mean, I went to the grocery store yesterday and there was a penny on the ground, and I just reached down and picked it up out of just routine habit. When I weighed 312, I could not have gotten down there to pick that penny up. It's too fat. You know, I mean, I could barely get in and out of my car. I couldn't cut my own toenails. Everything was difficult. You know, when you're that obese, I mean, it just complicates your life in so many different ways. I feel very fortunate to have a heart that's not damaged. I feel very fortunate to be getting better and to have had this experience, because it's really kind of created a whole new chapter in my life, you know, and I'm very excited about it. But yeah, I'm very grateful for Ascension. I'm very grateful for cardiac rehab. You know, do the work, but catch that fever. You know, you have to make that decision to change your life. And it's not really something you do for anyone else. You don't do it for your spouse. You don't do it for your kids. You don't do it because you want other people, you know, to think well of you. You got to do it because you want to do it. I changed because I decided I was going to change. You know, and I am continuing to change. I mean, I'm 232 now. I'm down 80 pounds. I would like to be about 200. So I'm sticking to the plan every day. And my advice is take the medicines your doctor prescribes, go to your appointments, and follow their advice. I mean, they're trained professionals. And I feel like if you've had a cardiac event, you're at a fork in the road. It's kind of like that old poem by Robert Frost, you know. You want to follow the road not taken. You want to walk down that path that has not been trod. And that's the path of physical fitness and eating healthy. And even in that context, do what you can. If you can't, I mean, I've kind of gone whole hog, but that's sort of my personality. If I do something, I'm really going to do it. You know, I mean, I eat 1,500 calories a day, and people are like, you eat 1,500 calories a day? I count every one of them. You know, but if you can't do that, then eat 2,000 calories a day. Do what you can. If you can't get your heart rate up 3 times a week for 30 minutes, get it up twice a week for 30 minutes, or once a week. And I think if you're gonna be presented with a cardiac event, you know, that's a perfect time to say, you know what, I need to make some changes in my life. You know, so I would say stick with it. Do the cardiac rehab and then join a gym. You have to decide, you know, not to be a procrastinator and in denial and, you know, eating these enormous servings and not paying attention to what it's doing to your body. You have to decide. And I didn't for a long time. I've been there. You know, I sympathize. It's not easy, you know, but for me, my heart attack was the turning point. You know, that was really, I adored cardiac rehab, but I really made my decision before I ever got here that I was going to change my life. You know, and they just gave me the tools.